Since starting with ACT some years ago, I've had a really strong desire and a really strong passion about the way that we view our clients and their experiences. Whether you're a psychologist, counsellor, social worker, occupational therapist, or someone who works with people, how we go out and view our clients, our friends, our family, really changes the way that we go out and, I suppose, treat them or support them. And I wanted to look at a particular paradigm that resonates with me and I'm really passionate about, and that's the paradigm of what is normal. I want you to just hold, just for a moment, I suppose a little bit of an exercise around this. Just for a moment, I want you to hold the idea that everything that came to you in your clinical room, in your clinical setting, was normal. A client comes to you and says that they're hearing voices, and that the voices are voices other than their own, and that the voices are telling them to go out and do things. And that your approach, rather than going out and categorising that and quickly formulating and putting that into an auditory hallucination and considering maybe that's a schizophrenic type of presentation, that rather than doing that, we held that and considered that's just one experience of many, and that in actual fact that's normal. That it's a part of what human beings can go out and experience. And when we hold it as being normal, it kind of means that we don't have to go out and push it away. We don't have to get rid of it. We don't have to try and challenge it, argue with it, remove it. But rather we look at how workable are those voices. How beneficial would it be to follow those voices? How useful are those ideas? How helpful are those thoughts to me based on the values and those things that are important to me? That's an interesting paradigm. The paradigm moves away from trying to get rid of experiences and calling them abnormal and saying that they're defective or wrong or that they shouldn't be there, to a new paradigm. And the new paradigm says that it's perfectly reasonable and normal to have that it's a part of anybody's experience, that it could actually show up, it could occur, and that we don't try and get rid of it. Likewise, if someone has a bad dream, we don't try and get rid of the bad dream. We go out and we understand it as a dream. And that dreams can sometimes be difficult. And just like when a child comes along and says that they're frightened, they've had a nightmare, we don't say that they shouldn't have nightmares. We pick that child up and we say, here, it's okay, and we give them a cuddle and we comfort them. We don't say it's abnormal and that they shouldn't have those dreams. So the paradigm is quite different in that we're looking at human experience as being normal rather than abnormal. We look at whether it's workable, useful, effective, or not so helpful, not so useful, and not so effective based on the values that someone holds. If we did it that way, how would we treat our clients? Would my client have schizophrenia, or would they sometimes hear a voice other than their own? When that voice shows up, do we need to get rid of that voice? Do we need to fight that voice? Or can we understand that that voice is there and still move towards those things that are important to us? That we don't fuse with the thought, we don't try and get rid of it, we don't go out for experiential avoidance and try and avoid all the discomforts, but rather we accept them as being part of our life. Just like if you went out in a really cold winter's day, we just accept that it's cold. And if it's really hot, we just accept that it's hot. We don't try and get rid of the hot or rid of the cold. We just allow it to be there. So that's a paradigm that I ask you to consider, to think about what would it be like when you go out and work with your clients next time when you sit down with them. How do you go out and approach their experiences? Do we need to get rid of them, or can they be there and we can focus on those things that are important to us? Hope that helps to stimulate a little bit of thought, a bit of food for thought, and hope to see you next time. Good luck with it.